In recent years, however, as I see it, the soil has now been tilled for the sprouting of views at odds with the narrative that I've just described for you. Today, I think many Canadians feel that there's a palpable momentum going another way, almost in non-recognition of this narrative, a momentum toward individualism, decentralization, privatization. I know some of these are buzzwords, but in the interest of shorthand, I think that is the momentum that is developing. And all of these today are described as new ways of thinking to deal with Canada's role and Canada internally in the world today. But in truth, they represent, I argue, an abandonment of our accomplishments, an abandonment of our history and the narrative that White talks about, and a parting of the ways with the belief in which our collective capacity to meet our many challenges is still strong in order to overcome the challenges. And Medicare, which is a product of that period, that narrative, is caught up in this new thinking. And just like with today's other major issues, how we choose to inform our way forward, how you advise and what your think tank proposes, and the set of values that you draw upon, that we draw upon to shape our progress, will, I argue, ultimately become an expression of who we are as a nation. Friends, that is why the debate over Medicare is not just about effectiveness and efficiency. It's not simply about what I think is the irrefutable evidence showing that our single-payer public system delivers excellent outcomes, which it does. It's not even about basic Canadian values like equity and fairness. Yes, it's about all of these things, to be sure, but it's also about much more. For Medicare holds such a central role in our narrative of shared destiny, in a way bridging communities, OHA, Change, Ontario, Canada, bridging communities, that how we deal with Medicare and our other social programs going forward may determine the nature and the progress of our country.